My name is Dr. Andy Reid. I'm one of the sport medicine physicians here at Banff Sport Medicine, and I'm going to go through some of the pros and cons and things to think about when you're having a cortisone injection.
Take it easy for the next 2 days.
We commonly use cortisone or corticosteroid or steroid injections to treat inflammatory conditions. So this may be an acute flare of an arthritic knee joint or a hip joint, or it may be to treat a tendon inflammation. And these injections are work very rapidly. Typically, patients will notice that they feel better within 1 to 2 days, sometimes even quicker than that, although occasionally the action can take a few more days to kick in. Typically, steroid injections can be given at 3-month intervals, although we do like to space them at less frequent intervals if possible. There are some side effects with steroid injections, and we know that repeated injections can cause more rapid deterioration in cartilage degeneration if they're used too frequently. And there are some reports of weakening of tendons or ligaments with repeated steroid injections. So if possible, we try and space those injections more than 3 months apart. Cortisone injections are the cheapest of the options that we do in clinic. Oftentimes you can pick up a prescription from the pharmacy ahead of time and bring the steroid in, or we do keep these injections in stock, and when we've administered one, we can give you a prescription so that you can claim it back, the cost back through your insurance. No specific preparation is needed for a cortisone injection. When you come in for the procedure, the physician will typically clean the skin with an alcohol swab or an alcohol wipe. They may or may not apply some local anesthetic to the area, and then we'll inject the affected area.
Little poke in the side of your knee here.
The injection itself, the procedures often done using ultrasound to confirm correct placement of our needle, although we don't always need to use ultrasound. We use a fairly small needle when we do cortisone injections, and we don't always need to inject some local anesthetic into the skin because the needle itself is typically not that painful. After a steroid injection, most patients don't have any significant problems, but occasionally the site of injection will be more painful, and some patients rarely can experience a significant flare where they'll have more swelling, more pain and bruising at the site of the injection. Having said this, most patients don't have any major problems with steroid injections. We typically recommend that you rest the area for 48 to 72 hours after a steroid injection. You can certainly apply ice to the area if it is painful, and we recommend that you keep the injection site clean and dry until the poke hole has healed over. If you do experience any significant side effects after a steroid injection, then we recommend that you contact your physician. And if you're concerned that you may have developed an infection, which is very rare, but if you're concerned you have an infection at the injection site, then you may need to consider contacting the emergency room. If you don't experience benefit from the injection, then we recommend that you follow up with your sport medicine physician. Normally, I would expect a response within at least a couple of weeks. So if you get to the 2 or 3 week point and you're not noticing improvement, then the best thing to do is to contact your sport medicine physician for a follow-up appointment.